All of this is no different fundamentally to me saying to you as a patient, hey, I know you've got back pain, I know you've got neck pain, just go take these tablets. They're a strong painkiller. Just go take these tablets. Take them every day. Fundamentally, that is no different to anything that we're doing here, because they are all versions of purely symptom-based therapy. Good afternoon, how are you? David Johnson here from the Back Pain and Functional Movement Training Centre. I saw this little video, or it was forwarded to me by a colleague. Obviously I'm going to play it. Here it is. There's a lady in a contraption that is creating some sort of traction on her cervical spine. And I saw this video and it's the inspiration for this little post. It really affected me, because seeing this type of therapy for people with spine pain just made me realise that we are in trouble in the musculoskeletal rehabilitation industry if this is what we're going to be resorting to offering our patients. It's a really sad reflection of our industry. So imagine if I was seeing patients with back pain day in, day out, which is what I do, and neck pain. And imagine if the only thing I said to them was, here's a prescription for some pain tablets, okay? That's my only solution. That's the only thing that I'm going to offer you, is a prescription for pain medication to help you control your pain symptoms as best as possible. Sometimes the pain tablets might work, sometimes the pain tablets may have very little effect, but if they don't work, maybe just double the dosage. Just take it 3 times a day instead of 1 or 2 times a day. See if that helps. And that's my only solution. Okay, that is evidently a purely symptom-based approach. And when you actually think about the vast majority of treatments, including that horrendous contraption, when you actually think about the vast majority of conventional treatments for back pain, they are all symptom-based, okay? We put people into odd positions to stretch them and manipulate their joints. We have procedural tables that must be very expensive to put people into positions to adjust their spinal joints that for some reason are not moving the way they should, or the way that the therapist feels that they should. We do needling procedures, we do stretching procedures. Some may say we do some strengthening procedures like this. We apply cold therapy, hot therapy, electromagnetic therapy, electrostimulation therapy, TENS machine, ice packs, hot packs, corticosteroid injections into the nerve, into the vicinity of the nerve, into the facet joints. We try to counsel people about their pain and their behaviours and their moods with cognitive behavioural therapy, cognitive functional therapy. We do spinal fusions, okay? All of this is no different fundamentally to me saying to you as a patient, hey, I know you've got back pain. I know you've got neck pain. Just go take these tablets. They're a strong painkiller. Just go take these tablets. Take them every day. Fundamentally, that is no different to anything that we're doing here, because they are all versions of purely symptom-based therapy. Very few people are treating the cause of pain, okay? So if you think about the fact that the lumbar spine or the cervical spine is simply a constellation of joints, and that the most significant factor that influences the health of a joint is the stability of that joint. Is the joint stable or not? Joints that are unstable are susceptible to injury. No different to you riding your bicycle. If you are unstable on your bicycle, you are susceptible to falling off the bicycle and sustaining an injury, which of course is painful. Stability is the ability to resist injury, okay? And therefore, in terms of a logically, empirically sound management strategy for spine-related pain, neck pain or back pain, we must focus on restoring spinal joint stability. And what is the most important means to restoring spinal joint stability? We must restore neural control of the specific muscles associated with that joint that determines the stability of that joint. Because a joint is only as stable as the neural control of the stabilizing muscles of that joint. If those stabilizing muscles are not being controlled effectively with appropriate neural control, then that joint will not be stable, regardless of how strong the muscles are. If they are not coordinated, if they are not contracting in your daily life activities in a manner that maintains the neural control of the joint, then that joint will not be stable. It will be susceptible to injury. It will be painful. So here's an example of a L4-5 discovertebral joint, okay, in the lumbar spine that has sustained an injury. And why has it sustained an injury? Because it is unstable, and there's the evidence of the lack of neural control that is normally afforded by the deep paraspinal intersegmental stabilizers, which you can see on the far right is the normal appearance of those muscles. Okay, it's all dark and fleshy, whereas here we see that the neural control, the neural input, the activation of those muscles is completely dysfunctional, and therefore we have lost stability and we are going to be acquiring an injury, which in this particular case manifests as a disc prolapse, which of course is very painful. And if you're also additionally unlucky, the disc prolapse can impact on the surrounding nerves, and then that will then give you sciatic pain. Okay, so that's why I made this post, because I wanted you to realize how simple it was and how simple and fundamental and empirical the the true spine care management is. It is essential that we restore stability, and unfortunately this is what most patients receive. It's pain management and a complete ignorance of restoring stability over and over and over again. And of course that leads to the recognised epidemic of low back pain affecting not only our country but globally. Back pain recognised as one of the leading causes of disability on the planet because we are obsessed with treating symptoms, and that is absolutely no different to me as a specialist just seeing my patients and handing them a bottle of pills that are painkillers. And that would never be accepted by my patients. No patient would walk out of my waiting room satisfied with that. And yet I do not understand how the rest of the industry can get away with this sort of stuff. Like, this is just, to me, unacceptably impactful, and we just have to stop doing this type of thing.